Welcome to PlacidWay Pulse, Thailand.
Hmm.
I was scrolling through my feed the other day, and I saw these photos of, like, a friend of a friend. Let's just call her Susie.
Okay, Susie.
Yeah, and Susie is posting these just incredible pictures from Phuket, Thailand. I mean, she's lounging under a cabana, she's sipping coconut water, looking out at this impossibly blue water.
Oh, wow.
Right. And the whole comment section is just people saying, like, oh my God, I'm so jealous, or enjoy your luxury vacation.
Yeah, it sounds like the classic social media highlight reel,
Yeah.
right? Where someone appears to have just, I don't know, dropped 10 grand on a five-star resort getaway.
It totally does. But here is the wild part. Susie was not just on a high-end vacation, she was recovering.
Wait, recovering?
Yeah.
Yeah.
She had just undergone a major cosmetic procedure, and even with the cost of the international flights, the procedure itself and that stunning beachside recovery, she paid significantly less than she would have for just the surgery alone back in the U.S. healthcare system.
That's amazing.
I know. She completely bypassed the, expensive, frustrating domestic medical system, saved a massive amount of money, and her friends just thought she was living her best life on a tropical holiday.
Which, I mean, she kind of was.
Yeah.
But we are so conditioned to associate major medical procedures with, sterile, stressful environments and just crippling bills.
Exactly.
So Susie's story represents a complete inversion of that expectation. When you look at the data coming out of these medical tourism hubs, you really start to realize that the traditional model of local healthcare is, well, it's facing serious global competition.
It really feels like discovering a cheat code for healthcare,
Yeah.
like a reality where you get premium medical treatment plus a tropical vacation for less than the cost of a standard deductible back home.
Right.
So, welcome to the deep dive. Today, we're exploring the booming world of medical and dental tourism in Thailand. And we've got a stack of sources in front of us today, including patient guides from PlacidWay, some package itineraries, and this really eye-opening cost comparison data.
Yeah. And our mission today is to really unpack the mechanics of this industry. We want to look at why millions of people are crossing the globe for medical care, how the logistics of this actually work, and, what it really looks like to treat major surgery like a five-star retreat.
Because it's not just a niche trend anymore, is it?
Not at all. It's a massive global industry with serious economic implications.
So, Susie's story got me thinking about the underlying math here. Like, how is this financially possible? Are we talking about a few $100s in savings, or is this a completely different economic scale?
It's a completely different scale.
Because my instinct is that to get those kinds of savings, there has to be a catch, right?
Well, let's look at the hard economics outlined in the PlacidWay data. The savings operate on a scale that most people just don't expect. We are looking at patients saving anywhere between 50 to 70% compared to what they would pay in the US, the UK, or Australia.
Wow. 50 to 70%. That is a massive margin. What does that actually look like in practice for like a typical procedure?
So the cost comparison tables in our sources break it down pretty clearly. Take a tummy tuck, for example. In the United States, depending on your state and the surgeon, that procedure can easily run up to $15,000.
Okay.
In Thailand, the comprehensive packages we're looking at range from $4,000 to $6,000.
That's a huge drop.
Right, and breast augmentation sits right around $3,000 to $5,000. Even complex bariatric surgeries, like gastric banding packages, which can be astronomically expensive and really difficult to get approved for in the West, they're coming in around $15,000 in Bangkok.
Okay, but when you hear a price drop from 15,000 to 5,000, the immediate assumption is that someone is cutting corners. You
Yeah.
know, you picture an operating room in a basement somewhere.
Right, right.
How do they actually achieve those prices without sacrificing the patient's health?
It comes down to macroeconomic factors rather than a reduction in clinical quality.
Mm.
The cost of living and operating a business in Southeast Asia is fundamentally different. First, consider the labor costs. And this doesn't just mean paying the lead surgeon slightly less. It means the entire support ecosystem, the anesthesiologists, the team of nurses, the administrative staff, the janitorial crew, all of them operate on a different wage scale that reflects the local economy.
So the baseline cost of merely keeping the lights on and the staff paid is just a fraction of what it is in Chicago or London.
Precisely. And then you have to factor in malpractice insurance. In a highly litigious society like the United States, doctors pay exorbitant premiums just to protect themselves from lawsuits. And, well, that cost is passed directly onto the patient.
Naturally.
But Thailand's legal environment regarding medical malpractice is structured differently, resulting in vastly lower insurance overhead for practitioners. But honestly, the biggest differentiator is the administrative structure.
Oh, I imagine the billing process looks a lot different when you aren't dealing with a dozen different insurance providers.
That is the core of it. In the U.S., hospitals employ absolute armies of billing coders, compliance officers, and administrative staff just to fight with insurance networks over what gets covered. Right.
It is a massively bloated bureaucracy. Thai medical tourism clinics, on the other hand, operate largely on a transparent, direct pay model. You're given a price, and you pay it. They have just stripped out the bureaucratic bloat.
It's like paying for a massive legal team every time you want to buy a cup of coffee versus just handing the barista a $5 bill.
Yeah,
You aren't paying for the coffee anymore, you're paying for the argument over the coffee.
exactly. That's a great way to put it.
But wait, what about places with universal health care? If I'm the UK or Australia, my health care is practically free at the point of service. Why would someone from Sydney fly to Bangkok and pay out of pocket?
Because the currency in those systems often isn't money, it's time.
Ah,
The public healthcare systems in those countries frequently suffer from agonizingly long wait lists for non-emergency procedures. The sources provide a really compelling case study about a patient named John from Australia to illustrate this.
oh, what happened with John? So John needed a knee replacement. His mobility was severely compromised, and he was in daily pain. However, because it wasn't considered, an immediate life or death emergency, he was facing a 2-year wait on the Australian public healthcare waitlist.
2 years? That's awful.
2 years of his life put on hold. Now, alternatively, a private clinic in Sydney can do it quickly, but the out-of-pocket cost was astronomical.
So he looked outward.
He bypassed the local system entirely. By booking a procedure in Thailand, he got into an operating room within 2 weeks of making his decision.
2 weeks versus 2 years.
Right. And here is the kicker. Even when you factor in the cost of his international flights and his hotel stay for recovery, he paid half the price of what that private Sydney clinic would have charged him. He literally bought his time and his mobility back.
That is incredible for someone stuck in a waiting room for 2 years. But if we follow the money here, a question naturally arises. If these clinics aren't charging premium Western prices, how are they affording modern medical equipment? Like, are we sacrificing quality for cost? You'd think a cheaper price tag means older technology, right? Are we talking about outdated MRI machines and hand-me-down surgical tools?
It is the most logical assumption to make, but the reality is actually the inverse. Because these clinics have stripped out that massive administrative and insurance split we just talked about, they retain massive amounts of capital.
Oh, interesting.
And because they are competing on a global stage for international patients, they reinvest that capital heavily into technology. To really see how this works, we should look at Thailand's dental tourism industry.
Yes.
It perfectly illustrates how their tech is often superior to a typical Western neighborhood clinic.
I was hoping we would get to the dental side because the concept of the Thai dental spa mentioned in the PlacidWay guides completely blew my mind.
The dental spa is a perfect example of redesigning the patient experience from the ground up. In the West, going to the dentist is historically an anxiety-inducing experience, right?
Oh, 100%.
You sit in a sterile waiting room, listening to the high-pitched whine of a drill, smelling clinical antiseptics. Thai dental clinics have reimagined this by replacing clinical anxiety with high-end hospitality.
Yeah, we are talking about clinics that offer aromatherapy when you walk through the door. The sources mention places where you literally get a foot massage during your root canal and they give you noise-canceling headphones so you can watch a movie while they work.
It's wild, isn't it?
I would go to the dentist so much more often if a foot massage was a standard part of the cleaning process.
I mean, who wouldn't? It changes the psychological approach to oral health. And the financial savings in dentistry mirror what we see in general surgery.
Right.
The data shows a single titanium implant in the West can easily cost $4,000 or more. In Thailand, those same implants range from $1,200 to $1,800.
Ah.
Porcelain veneers, which are, the cornerstone of a cosmetic smile makeover, they are $300 to $500 a tooth, compared to upwards of $1,500 back home.
Which makes a massive difference if you need a lot of work done.
Exactly. The guides highlight a patient named Sarah from the USA. She needed a full mouth restoration, which is a highly complex, multi-stage procedure involving numerous implants and crowns.
Super expensive.
Extremely. But by having the entire treatment plan executed in Thailand, Her total out-of-pocket savings exceeded $20,000.
20 grand. And just to reiterate our earlier point on technology, Sarah wasn't getting budget materials to achieve those savings, was she?
Not at all. The sources confirm these clinics use the exact same premium global brands you would find in a high-end clinic in Beverly Hills or London. We're talking about Straumann or Nobel Biocare for the titanium implants and IPS Max for the porcelain.
Okay, good to know.
But the real technological advantage lies in their diagnostic and manufacturing ecosystem. Many Western dentists have to refer you to a specialist for complex scans or send your impressions to an outside lab, right?
Yeah, and that takes forever.
Right. These Thai facilities are heavily capitalized to keep everything in-house.
Right, they use 3D cone beam CT scanners to get a perfect anatomical map of your jaw before they even start. And they use digital intraoral cameras, which means you don't have to bite down on that awful gag-inducing putty to make a mole of your teeth.
Yeah, nobody misses the putty. But the most fascinating piece of this in-house ecosystem is the CAD/CAM ceramic studios.
Oh, yeah, tell me about that.
CAD/CAM stands for Computer-Aided Design and Computer-Aided Manufacturing. Because these major dental hospitals have their own on-site milling machines and employ master ceramists on staff, they can take that digital scan of your mouth, design the perfect crown on a computer, and physically mill it from a block of solid ceramic in a matter of hours or days.
That is just incredible. It's like the difference between ordering a custom suit by mail and waiting a month for it to arrive versus having a master tailor cut and sew it right in front of you while you wait in the lounge.
That's exactly it.
So, because these clinics are built specifically for medical tourists on a tight 10-day timeline, they've essentially eliminated the agonizing weeks of waiting for an outside lab to build your crown. You don't have to wear a fragile, uncomfortable temporary tooth for 4 weeks.
They have built an infrastructure designed entirely around the compressed timeline of the international traveler. They know you are only in the country for 10 to 14 days, so the technology has to match that urgency without compromising the final product.
Which brings up a really crucial point about the logistics. Having a tailor make a suit in a day is one thing, but coordinating complex surgery, airport transfers, and clinical recovery halfway across the world sounds incredibly stressful.
It is a massive undertaking for an individual.
Like planning a normal vacation to Southeast Asia is hard enough. Planning a medical vacation sounds like it could easily become a logistical nightmare.
And that complexity is exactly why the concept of the medical package was created by facilitators like PlacidWay. They don't just book a doctor's appointment for you. They bundle and manage the entire clinical and logistical experience.
According to the itineraries in our sources, when you buy one of these packages, you are getting almost everything bundled into one price tag.
Pretty much.
It typically covers the surgeon's fee, the cost of the anesthesia, your private hospital room for the immediate recovery period, all the necessary pre-op blood work and tests, your basic post-op follow-up appointments, and even complimentary airport transfers.
And that airport transfer is far more important than it sounds. Imagine stepping off a 15-hour international flight, jet-lagged, anxious about impending surgery, and having to navigate a foreign taxi system in a language you don't speak.
Sounds like a nightmare.
It is. Instead, you are met at the arrivals gate by a driver and immediately taken care of. And the linchpin that makes this entire system function smoothly is the International Patient Coordinator.
The sources mention a patient named Ahmed from the UAE that perfectly illustrates this, right?
Yes.
Ahmed traveled to Bangkok for a VIP cardiac bypass. That is incredibly serious, life-altering surgery. Yet his experience in the documentation is described as entirely seamless.
And the reason Ahmed's experience was seamless is because he was assigned a dedicated, fluent, English-speaking personal assistant by the hospital. This coordinator essentially acts as your medical concierge.
Wow.
They translate complex medical jargon between you and the doctors. They schedule every single appointment. They manage the mountains of paperwork, and they even liaise with the hospital kitchen to ensure any specific dietary or cultural needs are met in your suite.
That is just...
Wow.
It really removes the friction and allows the patient to focus solely on their health.
That said, we should be clear about what is generally not included in these base packages, just so you, the listener, have a realistic picture. Usually, you are responsible for booking your own international flights, and you have to pay for your outside hotel stay for the days you aren't actively admitted to the hospital. That is correct. However, when you factor in the local cost of living, that extended recovery period is highly manageable. You can easily book a 5-star luxury hotel near the hospital for $100 to $180 a night.
That's less than a motel in some U.S. cities.
Exactly.
Mm.
Incredible, world-class food might cost you $15 to $30 a day. And from a legal standpoint, Thailand has actively streamlined the process for medical tourists. Patients can apply for a non-immigrant OMT medical visa, which legally allows for up to a 90-day stay specifically designed for extended treatment and recovery.
Okay, speaking of extended recovery, I had a major physiological question while reading through the flight logistics.
Oh, sure.
If I just got a new hip or a mouthful of dental implants, I cannot imagine jumping back on a 15-hour flight the next day. How does flying after surgery actually work?
It is a critical safety issue.
Huh.
You absolutely cannot fly immediately after major surgery, and reputable surgeons will strictly forbid it. The environment inside a commercial airliner is inherently dangerous for a post-op patient.
Is it because of the cabin pressure?
Primarily, yes. Commercial airplanes are pressurized, but not to sea level. At 35,000 feet, the lower air pressure causes gases in your body to expand.
Yikes.
Yeah, if you have just had surgery, that internal expansion can stretch fresh incisions, pull on internal sutures, or cause severe swelling. Furthermore, sitting immobile in a cramped airplane seat for over a dozen hours dramatically increases the risk of deep vein thrombosis, or blood clots, which can be fatal if they travel to the lungs.
So what is the actual protocol to prevent that? Do you just guess when you feel better?
No. The clinics issue mandatory fit-to-fly certificates. Your surgeon evaluates your healing progress and will not legally clear you to board an airplane until you've passed a specific medically mandated recovery buffer.
Okay, that makes sense.
For a simple procedure like getting a few porcelain veneers, that buffer might only be 48 to 72 hours. But for complex surgeries like a joint replacement, a gastric bypass, or a major facelift, you might be required to stay grounded in Thailand for 1 to 2 full weeks.
So recovering in a Thai resort isn't just a fun marketing gimmick or an optional add-on. It is quite literally a mandated part of the medical plan.
Precisely.
You have to stay near your surgeon for a week or two anyway to ensure you don't develop a blood clot on a plane, so you might as well do your waiting by the beach in Phuket with a coconut.
Exactly. The medical necessity of remaining in close proximity to your surgeon for follow-ups and observation translates perfectly into a restorative vacation. The environment actually aids the recovery process.
So the logistics are handled by a coordinator, the economics make absolute sense, and the recovery doubles as a vacation. But if you are going to confidently travel halfway across the world and let someone put you under anesthesia, you really need to know about the safety protocols. Like, how regulated is this industry?
It is heavily scrutinized. To understand the safety landscape, we have to look at the specific, rigorous accreditations these top-tier Thai hospitals maintain. They do not operate in a Wild West environment, you know. They are subject to constant external audits to prove their clinical outcomes.
Right. And the sources list several major ones. First, they detail the Hospital Accreditation, or HA, of Thailand. This ensures that the facility meets the strict national safety and operational standards set forth by the Thai Ministry of Public Health.
And beyond their national standards, these premier facilities seek international validation to reassure foreign patients. Many of the leading clinics hold ISO 9001 and ISO 14001 certifications.
Okay.
Now, ISO isn't just a plaque you hang on the wall. It means the hospital has implemented highly rigorous, externally audited systems. They have to constantly prove they have reliable protocols for tracking patient outcomes, sterilizing surgical equipment, and preventing medical errors.
That's reassuring.
You will also frequently see the Global Healthcare Accreditation, or GHA, which goes a step further by specifically auditing the safety and quality of the traveling medical patient's unique experience.
The sources also mention TIMOS, which is a German-based certification that focuses intensely on international patient care and ethical medical practices.
Furthermore, you have to look past the building and evaluate the practitioners themselves. A common feature of these leading Thai hospitals is that their top specialists hold dual-board certifications.
Oh, what does that mean?
This means a surgeon completed their rigorous medical training and is licensed to practice in Thailand. But they also went through the grueling process of obtaining and maintaining active board certifications in places like the USA, the UK, or Germany.
Wow, okay.
So from a clinical knowledge standpoint, they are operating at the exact same standard as a top doctor in New York or London.
But there is a cultural element mentioned in these guides that seems to go beyond just sterile safety standards and board certifications, right? The sources spend a significant amount of time focusing on the bedside manner.
Yes, they frequently reference the cultural concept of omotenashi, or what is often called tainus. It's a foundational aspect of Thai culture that emphasizes profound compassion, warmth, and impeccable hospitality.
It sounds like the difference between feeling like you are just a patient on a clinical conveyor belt versus feeling like a genuinely cared for guest.
That is precisely the contrast they are highlighting. Western healthcare, despite its absolute clinical excellence, often feels deeply sterile, rushed, and impersonal. Doctors have 10 minutes for you before moving to the next room.
Yeah, we've all been there.
The tennis factor aims to transform the hospital experience into something deeply human. The nurses and coordinators are renowned for a level of attentive, gentle care that actually reduces patient stress, which in turn genuinely accelerates the physiological and emotional healing process after a major trauma like surgery.
That human element is so crucial when you are feeling vulnerable and far from home post-surgery.
Absolutely.
But I do want to interject with a couple of very practical tips pulled directly from the PlacidWay sources for you, the listener. Because even with all this safety, the accreditations, and the amazing hospitality, you still need to be proactive about your own care. The sources highly recommend getting comprehensive medical travel insurance.
That is a vital piece of advice that many first-time medical tourists overlook. Standard travel insurance policies, the kind you buy for a normal vacation to cover lost luggage or a twisted ankle, often explicitly exclude any complications arising from planned, elective medical procedures.
Right. If you have an unexpected complication from your surgery and need an extra week in the hospital, your standard policy won't pay for it. You need a specific policy designed for medical tourism to cover those contingencies.
Exactly.
And there is one more extremely practical logistical tip from the guides. Always, always carry physical, hard copies of your MRIs and X-rays on the airplane in your carry-on luggage.
Because technology fails. Digital transfers get blocked by firewalls or corrupted in transit. You do not want to arrive in Bangkok for a major spinal surgery only to find out they have to delay your procedure because they can't access your scans.
It's about controlling the few variables you can control so that once you arrive, you can relax and let the experts handle the complex medical work. So, if we step back and look at this massive stack of data, patient stories, and economic figures, what is the ultimate takeaway here?
Well, if we synthesize all the data from these PlacidWay sources, the overarching theme is undeniable. Thailand has successfully proven that high-quality, world-class healthcare does not have to come with a bankrupting price tag, nor does it require suffering for years on an agonizing public waitlist.
Right.
By stripping out administrative bloat and reinvesting in top-tier technology and hospitality, they have engineered a system that delivers premium clinical outcomes efficiently and affordably.
And for you listening, whether you are considering a cosmetic transformation that you've always dreamed of, or you need a vital joint replacement to get your daily mobility back, or you are just staring down a massive, overwhelming dental bill, the data suggests that stepping outside your local healthcare system is a viable, highly regulated, and frankly, luxurious option.
The key realization is that patients no longer have to be trapped by the financial or logistical limitations of their domestic medical economy.
Which leaves us with a really fascinating question to ponder. If the borders of healthcare continue to dissolve and more patients realize they can cross an ocean to get world-class surgery and a vacation for a fraction of the local cost, will this massive loss of patients eventually force Western healthcare systems to completely overhaul their pricing and patient care models? Or will booking a flight to Phuket for a medical procedure just become the new standard normal for the global middle class?
It is a profound economic question, and one that hospital administrators in the West should probably be analyzing very closely right now.
No kidding. So next time you see a friend posting pictures sipping coconut water on a beach in Thailand, maybe take a closer look at their smile. They might have just discovered the ultimate healthcare cheat code. Thanks for diving deep with us today.